So good afternoon, everyone, and good day to those of you who are tuning in from other parts of the world. My name is Cindy Hallberlin, and I'm the Chief Ethics and Compliance Officer at the Digital Health Institute for Transformation, or in short, DHIT. At DHIT, our mission is quite simple. We connect industry leaders from healthcare and life sciences to the best-in-class solutions and innovations to drive a healthier world for each and every one of us. With that, I'm delighted to moderate this panel of incredible experts and innovators who've come together to really reshape the life insurance industry. And how are they going to do this? With the deployment of genetic risk testing to drive value to policyholders by delivering personalized health assessments to respond to an individual's genetic risk profile. Genetic testing has really emerged as a powerful tool in healthcare, offering insights of each individual's disposition to a variety of diseases and conditions. And as the healthcare landscape evolves, life insurance companies are increasingly considering the integration of genetic risk data to tailor their services to help drive a healthier and long lifespan of all of its policyholders. This webinar aims to delve into the intersection of genetic risks and insurance practices, not only to explore the potential benefits, but really to explore what are those practical implications of doing as much. So in order to demystify and peel back the onion and explore the potential for expanded life, and let's be real, expanded health span, because that's what we all want. We have three noted experts in their fields to support today's discussion, and I am delighted to welcome each one of them. We're going to start with Peter Donnelly, Sir Peter Donnelly, who is the CEO and co-founder of Genomics PLC. Peter, would you just say hello, because we know who we're introducing.
Hi, Cindy, and hi, everyone.
Great. Next, we have Marc Giguere, President and CEO of Munich Re Life US. Marc, would you?
Hello.
There you go. And finally, last but not least, we have Sears Merritt, Head of Enterprise Technology and Experience at Mass Mutual. Sears?
Hi, everybody. Good afternoon for those of you on the East Coast in the U.S.
And Peter, where are you hailing from?
I'm in Oxford in the UK.
Okay. And Sears? We just did Sears. I'm sorry. And Marc, where are you from? Where are you coming from?
I'm in New York City right now.
There we go. So we have an international group of panelists addressing us today. So on behalf of DHIT and our global community, thank you, all of you, for agreeing to participate in today's discussion. But before we kick it off, I have a few description of our format so people know what to expect. For the next 40 to 45 minutes, I will be giving questions to our panelists. They will be able to respond. It will be interactive, and there'll be discussion with each other. In the remaining 15 to 20 minutes, we have curated some questions that many of you have submitted when you registered for this webinar, and each of our panelists will have an opportunity to respond to those questions. However, we are not going to allow your digital hand questions during it because we will not have an opportunity to respond. Instead, if any questions arise over the next 60 minutes, please submit them to info@dhitglobal.org. That's DHIT global.org. And we will disseminate the questions to the panelists, and then in time, they will respond to them. And finally, this program is being recorded and will be archived for future viewing and download. So with that, let's begin, because this is the most interesting part. We'll begin with you, Peter, from London. So you're the CEO and co-founder of Genomics. So let's start with the basics. What is genetic testing, and why should any of us care about it?
Great place to start, Cindy. And let me give a bit of context. Until a few years ago, if I knew the entire DNA sequence of someone who was healthy, I'd learned something medically actionable in only about 2% of cases, 2 people out of 100. That's because for most of its history, genetics in medicine has focused on very rare diseases caused by a single letter change in our DNA. Now, those diseases are typically very serious, but thankfully they're rare individually and rare collectively. And that's why it only impacts about 2% of people if we look at people who are currently healthy. There's been a dramatic change over the last few years. It's now the case if I have DNA information on someone who's healthy, learn something medically actionable in about 70% of cases. So that change from 2% to 70% is because we now know how to measure the genetic component of risk for all of the common diseases, for heart disease, for diabetes, for the common cancers, breast cancer, prostate cancer, colon cancer, and so on. They're the diseases which use most of our healthcare budgets, and they're the diseases which cause most of the sickness and indeed most of the mortality in our populations. So it's that transformation of genetics from rare diseases to learning about all of the common diseases, which is at the basis of what's now possible. And I think the exciting developments we'll get to talk about. And interestingly, what we've learned is that if we take a disease like heart disease, there's not one place in our DNA that affects our risk of heart disease or two. There are something like 1 million positions in our DNA code that individually affect our risk for heart disease. Any one of those has a tiny impact. But we now have the sophisticated algorithms which can identify the 1 million positions which matter for heart disease. There are different 1 million positions for diabetes and another set of positions, a large number for a woman, for breast cancer, and so on. We can identify those positions and then use algorithms to combine the information from them to understand for each individual what their risk is for that disease. And it turns out this can make a big difference. For heart disease, some people are 20 times more likely than others to develop the disease because of their genetics. For diabetes, it's 30 times. For prostate cancer, it's 40 times more likely. So what that means now is that when someone's healthy, instead of just giving them the generic advice that we give about disease prevention and putting them into prevention and screening programs when they get to a certain age, we can move to a world which is much more personalized and much more tailored. Across all of the common diseases, we're all going to be at high risk for one or two of them. We just don't know which ones are the one or two that we're at high risk for. We can change that. And in our partnership with Sears and his colleagues at MassMutual, that's what we do. So policyholders are offered the possibility of a genomics test. If they choose to take that up, it's done in a way where the insurance company doesn't even know. Once they're consented and the order is approved by a physician, we send a saliva kit. The individual sends that back in a box we provided with postage to our lab. We get the genetic data, and then we give a personalized report to the individual, also with information they can take to their physician if they want to, with specific advice for them based on their risk of the actions that they can take. So it's a complete transformation in the way we can tailor prevention programs, both in terms of what we do as individuals and how we interact with our healthcare system.
Very interesting. Can you give an example of what that particular advice might look like for someone so people can get a sense of it?
Yeah, so if someone's at high risk for diabetes, for example, there will be advice about lifestyle and why it's particularly important for them. But we'd also point out to them that if they were to see their doctor can do an easy test, what's called an HbA1c measurement, to check whether they currently have diabetes. There are large numbers of people around the world, and in particular in the US, who have diabetes at the moment but are unaware of it, but it started doing the damage. And the sooner that can be identified and those individuals are put on treatment, the better.
Great, thank you. Sears, I'm guessing the value that Peter just described and the potential of MassMutual is interested to unlock value to their policyholders. So can you give a sense of how this meets the needs of the evolving industry, life insurance industry?
Yeah, absolutely. And I think maybe before zooming into the life insurance industry, I think some of the information that Peter has just shared around the evolution of genetic testing technology and efficacy is an important one to appreciate. Similarly, you mentioned comments around folks becoming, broadly speaking, much more interested in their longevity and maximizing their health span. If we rewind the clock, I think Peter threw out 5 years. I think that's probably a good number. We wouldn't observe the same thing. The mindset of a policy owner 5 years ago was not focused on longevity and health spans like it is today. And I also think there was less social acceptance or less broad understanding of how genetic risk-taking, testing, can actually benefit an individual. So you fast forward to today, and there's a broad, I would say, social acceptance of these capabilities, and a broad understanding of how they can benefit an individual. So that's what's on our policy owners' minds today, is they really want access to that information so that they can live longer, happier, healthier lives, just like the rest of us. The life insurance industry is in a really unique position to be able to meet folks where they are in that journey, and actually help them achieve it by forging strategic partnerships, much like what MassMutual and Genomics have spent the last handful of years developing. So we see the value of helping our policy owners living longer and healthier as a win-win scenario. As a mutual life insurance company who returns value back to our policy owners because they are in fact owners of our company, the longer we keep a policy in force, the more value that policy generates for themselves. So there's, I think, a number of industry trends that have evolved and at this point kind of converged. There's large social acceptance. And then again, the life insurance industry is in a very unique position to capitalize on the convergence of those trends and offer great offerings to their policy owners. And so that's what MassMutual has been focused on doing for the last 5 years.
Great, thank you. Marc, are you seeing this trend as well? What's Munich Re's position on this?
So I think maybe before I get into it, I should talk a little bit about Munich Re as a reinsurer, because not everybody's familiar with what a reinsurer is. At the end of the day, I describe us as an insurance company that insures other insurance companies, right? So to the extent that Sears and MassMutual might issue a lot of business, they may want reinsurance on that for somebody to share the risk with them. So we're a company that, while most consumers don't know us, we provide life insurance, quote unquote, to the life insurance companies. So with that, you'd expect that we're extremely focused on mortality and longevity, right? We want people to live longer, healthier lives as much as possible. So anytime we see a test or an opportunity for individuals to learn more about their health so that they can do something about it. And to me, that's the key. Over the last few years, I would say we've evolved from a point where people can do tests and maybe you'll learn something, but now you can take a test, you'll learn something, and there's something you can do about it, which I think is really, really important, because just knowing I have a condition might not allow me to live a longer, healthier, better life. But if I learn something, maybe I change my diet. That's a hard thing to do, right? We've tried to convince people to change their diets for decades. That's hard. But, maybe talk to a doctor about this so that they're aware, I'm aware, I can keep an eye out for certain things. So we are big supporters of any kind of test that can give information to policyholders. And I think more and more life insurance companies are looking to change the relationship with policyholders. Our industry for the longest time used to say, when a death happens, we'll be there for you, right? You can count on us. We'll pay out that benefit. Now, more and more companies want to change the saying to be more, what if we can delay that time, right? So we'll be there when you need us. Yeah. But what if we can help you live longer, healthier, and a better life? So I would say most companies are thinking about it. It is hard to do. It's a lot of life insurance companies don't have a close relationship with their end policyholders, right? They don't have the best ways of getting a hold of them. So that's changing, and we'll see more. And part of why I think the industry is falling in line with this is there's no other industry that's better aligned with policyholders, right? We want them to live longer and healthier, and they want to live longer and healthier. So it's a great thing for us to try to share that information from an industry that, it's not like we're trying to sell the drug, or we're just trying to say anything we can do to help you live longer, you should be interested in. So we see a lot of that. I think it's important also to point out we're still just coming out of a pandemic. And for life insurance companies, a lot of industries did pretty well during the pandemic, right? And they changed how they do business, and it wasn't a big impact. For life insurance company, we paid as an industry in the US probably close to $100 billion of extra death benefits during that pandemic. So it's a big financial impact, and I'm proud to say every insurance company we've seen came through that, was able to meet their obligations. But at the same time, you'll recall middle of last year, so let's say sometime around summertime 2023, newspapers started saying the pandemic's over, things like that. But life insurance companies have seen elevated deaths continue, not at the rate that we were seeing them before, but they're still higher than they were pre-pandemic. And part of why we see that in the US, and the US was probably more affected than other developed countries, is because of the existing health of our policyholders and of the general population in the US. And I think we had more comorbidities and more health problems that made the pandemic worse on Americans. So to the extent that we can try to reverse that by giving them more information and helping people be healthier, it's going to be great for the general population, and it's going to be great for the life insurance industry.
Thank you. That's great. So I'm going to kick it back over to you, Sears. By providing genetic risk tests to your policyholders, what are you really hoping to accomplish?
Yeah, for us, it's really simple, and it's kind of where we started this whole conversation. We want our policyholders to live as long as possible, and have an exceptional health span, so that they can have a happy, healthy, rewarding life. That's really what motivated us to begin exploring this space in the first place, and begin to forge relationships with folks like Peter and Marc here. It's really that simple.
Great. So back to you, Marc, for a moment. What do you see as the next practices, not necessarily best, but next practices for industry leaders taking to provide policyholder value creation when you're looking out into the future? What is the next?
So, we get a lot of questions from companies just asking what other tests are out there and how we can help get approvals from regulators. Life insurance companies are a heavily regulated group, and we need to make sure the regulators understand that all we're trying to do is help people live better lives, right? So I think more and more companies are looking into that, looking for ways that they can provide that and be educators for their policyholders. But also, I think this will allow us to change the relationship between policyholders and life insurance companies. So I've been in the industry a long time, and they used to say that a life insurance company talks to you when they issue the policy and when somebody dies. And that's not true anymore. Companies want to have a more immediate and close relationship with their policyholders. I always find it surprising that policyholders seem to have a closer relationship with a property casualty carrier that insures their car, their homes, and the company might know how they drive, they know how their house was built and how many people live in it. And with life insurance companies that want you to live longer, we have very limited information. So I think that over the next few years, you're going to see that changing, how we can be better connected with the policyholders.
Great. Okay, now I think we've gotten ourselves a solid foundation of why we should care about and what's in it for all our stakeholders. So now let's dig a little bit deeper. Sears, I understand in a recent press release, and I'm going to quote it here, Mass Mutual launches innovative wellness offerings that help policy owners better understand and protect their health. That you're well on your way to unlock this value. I mean, you started this already. Can we just double down on this and speak to the collaboration with genomics and rolling out this program? How did it work? How did it expand?
Yeah, so it all started with an idea, motivated behind what we've been talking about here, which is a life insurance company has a very unique opportunity to help its policy owners in really dramatic and impactful ways, right? Helping them live longer, happier, healthier lives. So it started there. And we asked broad questions around how can we do that? And through some introductions and industry scans, we were fortunate enough to cross paths with Peter I believe, Peter, we met in the UK. I think that was the first time our paths crossed. So we went out and sat down with Peter and got to know him and his company, and more importantly, the capabilities that genomics has spent the last number of years developing, and very quickly realized that we had a great opportunity to work together. One of the first things that we learned about each other, less about the technology, was more about our shared values and why we're in this business, and how we would want to work together to create that value for consumers and mass mutual policy owners. So that was the really exciting piece for us that kind of started this collaboration. Well, once we got that out of the way, I would say the rest of it looked very much like a research project. So we started formulating a set of hypotheses around what questions or what assumptions we had about our policy owners and their desire to gain access to a technology like the one genomics has created. And then we worked together to, again, run a series of experiments that got at the heart of what folks were looking for, and I think more importantly, how they wanted to gain access to that information. So what kind of experience was really going to be best suited to give them, right, a tool that's as powerful and impactful as what genomics has created. So that took probably a couple of years and a handful of experiments and market research and various things to play out. We got all of that information, and we turned all of that into a kind of an end-to-end experience that we offered to our policyholders, still at a very targeted, localized level, factoring in the fact that this was still relatively unknown. Right? A life insurance company hadn't done this before. We wanted to treat the trust that we had developed with our policy owners with care. So took some pretty systematic steps around rolling this out, gathering feedback from our policy owners, and then checking and adjusting the experience along the way. So all of those things worked quite well and generated a lot of information for us that we're now using to think much longer and broader in scope around how we can use this related to, a more comprehensive wellness program. But if we just bring this back to our relationship with genomics, we're now in a position where we've got an exceptional experience. Our policy owners love it. We get calls, emails, success stories every time somebody goes through this. So we've taken all of that and put together a national rollout plan and are making this available to as many qualified policy owners as we can. So we're, again, really excited. But going back to the original question, this all started with some open ideas, some unanswered questions, a handful of what we believe to be probably the most important thing, which is some shared values, focusing on our customers and policy owners, and then just doing science and generating the information we need to now get us to where we are today.
That's great. Thank you so much. I'm going to pass the ball over to Peter. What have you learned from the initial phase of this? As he said, it was a research experiment, and conversely, what are the opportunities that you've also discovered that you hope to address?
Thanks, Cindy. And let me just start actually by echoing a point Sears and Marc have made, and for people less familiar with this area to kind of help clarify. This is all about using these tools to help people who already have life insurance policies. Correct. It's nothing to do with using genetics to try and decide whether to insure someone or how much to charge them. Sears talked about shared values, and that's something his company and he and I and our companies feel strongly about. This is about people who already have a life insurance policy. And what's very special about this is the absolutely perfect alignment of interests. You've heard it from both Sears and Marc. The life insurance company are first of all, they care about their policyholders, but they're actively incentivized to help their policyholders to live longer, healthier lives. It's in the insurance company's interests, and it's in the policyholder's interests. So that bit's really helpful by way of context. In terms of our learnings, there are a lot, but let me highlight three areas because I think they're pretty interesting. The first one, which Sears has already talked to, and we do our own surveys, is a very high level of enthusiasm from the policyholders, both before they take the test and then after they get the results back. So, for example, 82% of them either agreed or strongly agreed that they found the results valuable. And almost 3/4 of them were very motivated and activated to do things on the basis of the results to improve their health and their health outcomes. And again, this isn't about treating existing conditions. It's about helping people make the changes they need to individually and interact with their health systems well enough in order to prevent disease or catch it early. And as Marc said and implied, we focus only on diseases where there are things you can do if you're at high risk, where there are either individual actions, your lifestyle, your diet, and in most cases, things you can do in connection with your healthcare system that will either act to prevent disease or reduce your risk or to catch it early. So that was the first bit, the enthusiasm. The second bit, I mean, it's another key part of the values that Sears was talking about. Absolutely central to what we do as a company is maintaining the trust of the individuals we work with and whose data we have, and being completely transparent about how we use that data. That's something that's absolutely embedded and at the core of everything we do as a company. We also put a lot of effort into data protection, into having the right quality standards, into cyber security protection. We pass HIPAA, GDPR, which is a very high European standard for data. And as I said, we're very transparent with individuals about what their data will and won't be used for before they sign up. So it was great for us to learn, an important learning, that the vast majority of the individuals, after they'd been through the process, had confidence that their data had been handled securely. That's completely critical. As Sears said, the trust of those individuals is absolutely central to the whole program. And then the third part, which was of interest, one of the things we asked the individuals, the policy owners who took the test, was about their view of their life insurance company. And over half of them had an improved view of their life insurance company as a consequence of the offering and what they learned from it. So I'm sure that's something that Sears and his colleagues were hoping for, and Marc as well, and they've explained why that makes sense. But it was great to see that in practice, and that I think increasing the connection between the policyholder and the insurance company as a consequence of offering this. Just briefly in terms of opportunities, our early work only looked at 3 diseases per individuals. In the program Sears is talking about, where we're rolling it out, we're looking at 7. We'll continue to expand that. And we're also looking at ways to make it even easier for people to take the actions that they need and to interact in the right way with the health system. And perhaps I could come back to that in some of the later discussion.
Why don't you, before we get back to that, why don't you just give us an example? That's very interesting. How do you see it getting easier, Peter?
I think at the moment, what we do, and we're very proud about it, and as Sears said, it's an offering that the policyholders find very helpful. We do the test and we give individuals results. On our roadmap is to evolve that into a situation in which, for those policyholders who want it, we have something which can stay with them, something, imagine an app. So it's not just giving their results once, it's helping them navigate their health system if they need to, potentially giving them nudges about the behavioral things that are important to them and that they're happy to be nudged on. In time, again, with their agreement, that could even become 2 ways. So if the individuals are prepared to share information with us about aspects of their clinical data, for example, we can use that to improve the prediction even more and get more value. So it's all about evolving things to be more effective and be even more powerful in terms of helping people change their health trajectory. In time, actually, there's even the possibility of using some of the modern AI techniques if you're getting information from individuals to flag potential diseases they might be suffering from at the time. One way I like to describe it is, at the moment, for most of us in society, we're kind of passengers on our own health journey. And it's a very passive relationship. what we're aiming to do as a company and what we're aiming to do through the program with Sears and his colleagues is to change that so that people can become co-pilots in their own health journey. They have the information in order to be able to do the things that can affect the outcomes rather than just watching them as they come.
I love that analogy. So I'm going to kick it over to you, Marc, and ask you, after listening to these discussions, what are you really most excited about from your perspective at Munich Re?
Thanks, Cindy. So to me, I started hearing about the pilot that Sears and MassMutual were doing with genomics a couple of years ago, when one of the people that works for our company said, "Oh, I got this email from MassMutual. I tried to sign up for it, and I think maybe in the first weekend, Sears, it sold out." Yeah. Right in the first pilot, people were looking forward. They were so excited about getting that kind of information. And you can probably say they're more of a certain group than another group that signs up for this and things like that initially. But that was the first time I heard about it. And the reaction was, I got this email this weekend. I tried to sign in, couldn't get in. It sold out. So we knew, boy, there's something here, right? It can be confusing right now. You get opinions from everybody on everything, right? So if you're gaining weight, your third cousin probably writes you a text about, hey, you should try to do this differently or that differently. So I think it's really important that we go back to science. Here, we're doing these tests. And the science has changed so much in the last few years of what we can find out, that I think there's a lot of information there. So to me, it was amazing that the policyholders were that responsive and were ready to accept MassMutual on that offer. Another finding, Peter, you didn't mention it here, but you've mentioned this to me before. I believe that the people that received some kind of indication that they were more likely to have, be exposed to something, had a discussion with their health providers 3 times as much as the people who didn't, right? So people who find out that they might be predisposed to something or that they should be doing something differently did something about it. They went and they talked to their doctors. And we've done some work over the last few years where you do see that people don't really talk to their doctors, right? Like when you go in for an appointment, your goal is to get out of there as fast as you can. And if it's a physical, you give your blood, right? You do that stuff, and that's not good. It's good that we can have these discussions, and I think this just equips people with more information so that they can have that kind of discussion. So I think the program is great. I think I'm excited about the fact that people are taking more and more responsibility for their health, and they want to get the information. Like I said, as a reinsurer, and I think life insurance companies overall, we just get a lot of data, right? We see a lot of things happening, and we get medical information, and you can see trends and things like that. But right now, there are so many companies that are investing in this space, or new startups that are trying to find new ways of helping individuals. We're hearing about companies that as soon as you have a cardiovascular event, they could set you up with a counselor to make it easier to follow the rehab as to how you rehabilitate from that cardiovascular event. Because if the answer from your hospital system is, well, you're going to have to come and see your doctor every second week and you're going to do this, it's amazing how either life gets in the way or people don't want to do that. If we can make it easier, so Peter's point, right? We're going to make it easier and easier. And there are a number of companies are looking at how we deliver healthcare, or more important, preventative care. Healthcare kind of implies you have to get sick and then we'll make you healthy.
Right.
Preventative care of how we do things to make you better, I think, is great. And life insurance companies are in a great position to partner with these companies and do things. We don't have to invent everything ourselves. It does, life insurance companies, we're great at what we do, but these startups can really come and help us. We have the right policyholders, we have the right financial models, we have all of that can really, I think, help. The other thing that I think is really interesting is we don't have to make it complicated. The beautiful part about the pilot MassMutual did and how they're doing it now in the real program is it is kind of simple. If you sign up, we'll get you the test. You take the test. You don't have to call us. You don't have to come and give us all this information and record everything. you work with Genomics PLC, you get your information, and you do something about it. That's good. When we overcomplicate things and we kind of say,
Right.
how can we apply this? How are we going to get the data? How are we going? No, it's nice and clean. And it shows how it's for the betterment of policyholders. Insurance companies, every program we've seen, they don't get the detailed results. Right? So it can really show that we're not doing this to deny a claim, or to Peter's point, which was an important point. Nobody's doing this to prevent somebody from buying insurance. Right?
And that is the perfect segue, Mark, to the elephant in the room, which I think you have begun to address. And what's that elephant? We all know it to be privacy. There isn't a day that goes by that we all aren't alarmed at breaches of data privacy in all different organizations. It fills our news feeds for however we get it. This is a critical area of privacy, right? Your genetic risks, the insights on your health are as sensitive a data as I can imagine. So take us, Sears, through how that data is being protected and used. And Peter's made some discussion, Mark has, but talk to us about it because it's paramount in everyone's mind.
Yeah, well said. It is paramount in everyone's mind, and it's something that needs to be thought through carefully and managed with precision. And I think maybe taking one step back, I think as everybody is aware, right? Data is kind of on everybody's mind today.
Mm-hmm.
And given these trends that we've just been talking about around health, genetic risks, being able to take action with your doctor, right? That data is going to continue to be generated. And we're going to find increasing ways in which we can use that to do all sorts of things, certainly focused on health. But it's not hard to imagine, right? We often hear about the connections between health and wealth.
Mm-hmm.
And how, right, somebody that's healthier might be in a position to also be wealthier, or vice versa. So I think what we're going to see is these trends of people accepting the technology, companies like MassMutual identifying needs and partnering with folks that have the capabilities to continue to provide these more holistic, integrated experiences that connect what used to be very disparate concepts, right? So health and wealth are two that are really important and interrelated, and we still don't actually know, right, all the causal relationships there. But it's not hard to imagine somebody sitting down with a financial advisor in an agency and actually talking about their health status and thinking about how that might need to impact their financial plan. And so having access to that data and being able to use it in those ways to inform actions and planning is really important. So that brings us all the way back to making sure that we have clear policies and world-class capabilities put in place to think about the appropriate ways in which a company should use data is something MassMutual has honestly spent years developing and putting in place, right? So getting really clear on under what conditions is a particular piece of data suitable for use. And then similarly from a cybersecurity perspective, making sure that we have all the software and security capabilities put in place across the databases and systems that manage access to this data is another big piece that we've put in place and continue to enhance and mature through time. And that goes for things well beyond just the data that we're talking about here. And then I guess in closing, MassMutual's perspective on genetic data in particular is that we don't actually want that data or need it to provide value to our policyholders. And in fact, in this particular case, we never see any of this information. All we want to do is make it available to our policy owners for all the reasons that Peter and Marc just explained. They're more likely to take action. They're more likely to figure out ways in which they can use it to increase their health span and longevity. If that's right, and that's the impact that we are trying to create. So the more that we can enable that type of behavior while at the same time avoiding having to have that data or be stewards of it, the better. Now, on the flip side, the people that we do partner with, genomics being obviously one of them, we do want to make sure that, again, starting from values, right? Policy owners, consumers, their privacy, and all the other things that Peter had mentioned are top of mind, and that those values get implemented in technology and controls and policy within the firms, so that, again, we can be consistent and transparent with folks that want to engage with us.
Great. Marc, do you want to add anything to that?
So I agree with everything that Sears said. I think insurance has always been a data heavy industry, and our process for issuing life insurance is very data heavy. In fact, usually if you apply for life insurance, there's going to be an authorization at the bottom saying, I give the insurance company the right to go pull all the electronic health records they can on me in order to assess my risk and determine what premium to charge. So I think it's really important to be really clear on what data we can get, how long we can keep it, what we can do with it, and try to always reinforce that, especially with the third parties we work with, because I think some industries everybody's careful with data now, but they might not understand the power of the data we have in the insurance space. If you could find out that a certain politician is exposed to a disease and things like that, you can imagine if that gets out, it could be really bad. So I don't think it's decreasing as a priority. Privacy is only going to stay up, but we have to balance that with the fact that we get a lot of data. We need a lot of data for our business. The tricky part will be when things like this test at some point, when I get the test, if I get a result that says I should do something about it, I'll probably talk to my doctor about it. And then all of a sudden it's in my medical records, right? So there might be something that the insurance company said, hey, you take this test, it's just for you. But then the next time they buy insurance, there'll be something good or bad, right? So it's going to evolve quite a bit over the next few years, because I think a test like this test will become more and more commonplace, right? Everybody's going to want to get it if they can. So we just have to know that. So if we know somebody is more likely to have a cancer, what do we do about that? Do we say, well, we got to be careful, they're more likely to have the cancer? Maybe. But now we also have to adapt for the fact that now we know that they know, so they can do things about it, right? So it's not.
It's a balance, right?
It's a balance, and I think we're going to keep talking about this one for a while, I'm sure.
I think you're absolutely correct. So I want to thank everybody for helping us understand really where privacy starts and perhaps where it ends. But I think, Marc, your insights are the end of it keeps going. As you share this information, the issues will evolve. And that's something that we have to keep watching. So let's shift our focus for a minute to really look out into the future, because that's an interesting place for us to be, because we would all agree with the advent of AI and technology, the rapid change of things in life is at a pace that's hard to imagine. So Peter, going to a future focus for a moment, if you could wave a magic wand, and you started when you began to discuss a few moments ago about your roadmap, take us to 2030 and what would be successful. Paint us a picture of what that would look like. And then, it's a two-part question, give us a 1-minute pitch, okay, as to what is the benefit of genetic risk assessments in one sentence. What would it be? One sentence is always hard, to start with your roadmap.
Thanks. So I'll do the first part of your question first, Cindy, as I hope you get the sense. I'm personally, and we're personally, incredibly excited about the positive impact these kinds of approaches can have. I laughed relatively recently when I spoke to a senior medical figure in the US. He was thinking about the current way health systems do prevention. They measure risk all the time to work out who to put into screening programs, who to put into prevention programs. They do that in really clunky ways currently. For many diseases, it's just age. When you get to a certain age, screening starts. And he looked at me and he said, when he was kind of thinking about this possibility, he looked at me and said, oh my God, we're going to look back at what we're doing now as like doing medicine with leeches, because we will have the possibility of actually doing personalized or precision medicine. Now, the field has talked about personalized medicine, precision medicine for many years. We have a completely different way and a much more sophisticated way of thinking about risk for the individual. And yes, some of us will be at higher risk for colon cancer, say, but others of us will be at higher risk for heart disease. We don't know any of that now. And by learning that, we can just tailor the route for an individual through the health system more effectively. We can give them better advice as individuals. From a health system point of view, they can use their resources more effectively. They're running prevention programs and screening programs and so on. This is about getting the right people into the right programs at the right time. So that's the world we see in healthcare broadly. 2030, I think we'll be well on the way to that. I don't think we'll be as far advanced as that. What's really interesting about today's discussion is exactly because of that alignment of interest, exactly because the insurance companies, A, care about their policyholders, and B, are incentivized. They really want to do things in a way that's an absolute win-win alignment of interests. So I think that'll be one of the major drivers. Sears has talked about our program with Mass Mutual, where it's being offered to large numbers of people nationally across the US. That's a first. It's not just first in life insurance. It's a first across any industry and in healthcare. And I think the potential is huge. What's the pitch? The pitch is that we can learn about risk in very sophisticated ways now using modern technologies. And that helps an individual as a co-pilot and a health system with that information tailor prevention programs and tailor screening programs to the individual. And in time, and this is another really exciting bit, in time, it'll also help health systems work out what are the right therapeutic drugs when this individual gets a particular disease rather than that individual.
That's great. Well, here's the good news. You've convinced me, and I'm considering changing my policy to Mass Mutual for all the opportunities. So great pitch. So now we have a few minutes left. We always run out of time with these interesting discussions, but I'd like to focus you all on some of the questions that were submitted in the time that remains. So the first question is, can genetic testing be included in clinical trials, studies, to recruit diverse participants for drug discovery and biopharma? Who would like to take that?
Shall I kick off maybe?
Yes, kick off.
An area in which genomics is very active. Sort of relates to what I said at the end of my pitch, Cindy. One thing that's only just becoming clear is that these genetic scores can be very predictive of how well a particular drug will work. So there are a couple of examples of that. So statins, which are a well-known drug. There's a lot of evidence now that people who have a higher genetic risk for heart disease show a larger therapeutic response to statins. And the latest cholesterol-lowering drugs, so-called PCSK9 inhibitors, are the same. We're working with a number of the forward-looking pharmaceutical companies in other disease areas, and there are an increasing number of examples where these kinds of tools can find for a particular drug, it can find who are the right patients who will most benefit from the drug. And from the individual's point of view, once you're sick with a given condition, how do we work out what the right therapeutic drug is to treat you with? So it's actually a really insightful question. I think this is an area which is in its infancy, but will be large and a big part of the way we think about delivering medicines.
Yeah, I think it's very exciting. So that's a good segue to the next really interesting question. Do you see a day when we have a health score, like a credit score, whereby our health score will tailor our day-to-day nudges by a supply chain of digital health interventions?
Sorry to monopolize. Hopefully there are other questions
take it
better
away.
suited to my colleagues. Yes, but not one health score. We each have a risk for heart disease. We each have a risk for diabetes. The women amongst the audience will have a risk for breast cancer. The men will have a risk for prostate cancer. That'll all be different, and it's pretty random. If you're at high risk, genetic risk for heart disease, you're no more less likely to be at high risk for diabetes or prostate cancer and so on. So the idea of one score isn't going to be accurate, but the idea of a set of scores and an understanding of our risk based on genetics and in time, based on other risk factors for those diseases when the information is available, that should certainly be helping us navigate health systems and helping health systems, as I said, get the right people into the right programs at the right time. But I think you're absolutely right, Cindy. It will also, there's also the possibility for people who want this, I think many will, but not everyone will, that it can help give us the right sorts of nudges in terms of our lifestyle choices.
And that's key, obviously, because behavior change is what we're all looking for, because that drives the opportunity for a healthier person in a longer life. Great. Any others? Would you like to comment on that before I go to the next question?
Yeah,
Mark or Sears?
Yeah, I was going to say similar to Peter's comments in life insurance, we actually did develop a score much like this. We actually call it Life Score 360. And the intent behind it is it doesn't use genetic information, but it does use a pretty comprehensive set of data points that are used as part of the process of issuing life insurance to an applicant. And the idea was very much like what's behind this question. Wouldn't it be nice if a consumer had a score that let them understand their life insurance risk so that they could use it to figure out which types of products and services they might want to buy. And so that the folks that participate in the industry, life insurance carriers, reinsurers, and the like, could have a common understanding of that risk so that they know how to assign a premium to the score. But more importantly, so they also know how to help those potential policy owners figure out the steps they can take, right, to manage their risk. And in some cases that'll involve making behavior changes to make themselves healthier and the like. Great.
Mark, do you want to add anything?
No, I agree with what's been said. I think the life insurance industry has done scores for a while. They're evolving quite a bit. We get to use more and more data and more information. I think the part that maybe I haven't seen as much of in the life space is sharing that score back with the applicant so that they can understand and they can get other information to do better. But I think we've been trying to score these lives for a while.
Sorry, Mark, that's a perfect segue to the next question. How did you know? So the next question that we received was, what other data would be valuable to integrate into the risk scoring based on policyholder engagement? In other words, what's after the initial test? What other information could they get?
So maybe I can go first on that. So
Sure.
To me, as we get more and more electronic health records and we get more medical claim information, we are seeing that people go to the doctor and they go do tests. So that data is becoming more and more accessible, always with the authorization. If it's not de-identified, it's with the authorization of the policyholder. But the health systems are doing a better job at standardizing their data and their forms so that they can make that available. In fact, they have to the extent that it's not their data, it's not their information, it's the policyholder's information. But just in the last 2 years, the amount of information we can get now to score is pretty impressive. We used to completely depend on people telling us their information, right? Maybe they forget to tell us about something. Now there is so much information out there that we can remind them, and we can actually show that the combination, if you take this information from this provider and another test you did, if you put them together, it's not additive, it's multiplicative, right? So, yeah.
Great. So we only have a couple minutes left, and I'd like to just do a quick round for our panelists to add any final comments that you would like to share with the group. What are you most excited about? What are you looking forward to? What do you hope into the future? And I'm going to start with you, Sears.
Yeah, I'm very excited to continue the journey that we have started with genomics. We've got some big ambitions for what we believe we can do together and the impact that is going to have on our policyholders. So very excited to continue to partner and carry what started out as, again, just that basic question and a big vision, carry it into the future and actually put it into practice.
Great, Mark.
So I'm going to say what's important here is I want people, the 2030 question for Peter, right? In 2030, I want people to say, it's amazing how the life insurance industry brought all of this to the general population, not the healthcare industry, which you would think would be an obvious pick, maybe the employers, but the life insurance industry is making this accessible, and then it will become commonplace in our health system and employer benefits. So
That's great. Peter.
Well, I mean, I agree with both Sears and Marc's comments. Let me just add, on our side, we have loved working with MassMutual, with Sears and his colleagues, to work out how to do this properly and to do it well and to do it really effectively. And as Sears said, we think we've got to an offering which does that, and the policy owners love it, so that's fantastic. That's one life insurance company. There are many, many others. I do think there's an opportunity for these sorts of changes to be driven by the life insurance industry. I keep going back to that fantastic alignment of interests. We're incredibly excited about our partnership with MassMutual, but would love to be working with many other life insurers.
That's great. So I just want to take an opportunity to thank all of you for taking time out of your busy schedules to share your insights, your ideas, and what you see in the future. I think it's really helpful to everybody on this panel, to myself that's listening to it. But sadly, it looks like our time is just about up. So I want to thank our audience for participating here today and listening and engaging what we think is a pretty critical issue to drive us from healthcare to health with longer and a healthier lifespan for everyone. So we will be making this webinar available for download and on social channels. And of course, you can visit our website at dhitglobal.org. And again, thanks to our panelists, to the audience. Stay well, be happy, and enjoy the rest of your day. Thank you.
Thank you very much.
Thank you.
Cheers.